My thoughts are really we welcome what the Minister has announced today. This is something we've been working on for a long time now in the past in the Midwest region. But over the last number of months, the amount of headway that had been made in achieving the announcement today has been unbelievable. Again, this is something that didn't happen overnight. There's a lot of people and groups to be thanked for it. I mean, we can think of the Friends of Innes Hospital, the health service campaigners, the HSE staff in the Midwest region, and people that went out and fought to get an upgrade of services in the Midwest region, which are important and vital for patient safety. We've been saying this for a long number of years. Now today, this announcement is simply fabulous and fantastic, and we have got a briefing on the same, and my belief is there'll be action early in the new year to start the process of achieving options A, B and C going forward.
To what extent, Joe, do you think that the campaigning had an impact on the Health Minister's decision and illustrating the importance of progressing all three of these options, especially that crucial third option, the development of a new hospital?
Well, first of all, I'd say is the cross-party support and Oireachtas member from the Midwest region. They got together when the HIQA report came out. We sat down, we felt and we know what was needed for the Midwest region. We worked as a team, and that's vital and important, working as a team. We did sit down with the Minister. We did outline the serious concerns that were there. She did take those concerns on board, and with the announcement today, she was well aware of we working as a team, cross-party members, working together to achieve what needs to be achieved for the Midwest region. My belief is she did take that on board, and she saw the urgency in upgrading services in the Midwest region, and my belief that did help. And also the different groups, everyone involved over a long number of years that did fight for improved services in the Midwest region, that also had a bearing on the outcome today.
The news that option C will be progressed has been welcomed across the board really in recent hours. But of course, one point that is concerning some people, Joe, is that statement that it will be progressed within the next 10 to 15 years, or that the Midwest will see this new hospital come on stream in the next 10 to 15 years. That's a long and a vague time span. What's your own feeling on that? Is it good enough to be told, yes, we will do that, but it'll be in this 10 to 15 year period?
First of all, it's a massive welcome that option 3 is still on the table. We've been told in our briefing today, option 3 won't happen overnight. As we're all well aware, none of them will happen overnight. There is design, there is sites, there's different things to be looked into, but that option 3 would not be left on the long finger, that would progress to design stage, and whatever other commitments have to be given to progress it forward will happen in conjunction with the other two. We're not saying that option 3 will be delivered over the same period of time as option A and B, but it will be working in conjunction with the other two developments, which is also very important.
And Joe, you mentioned that you met with the Minister today. Do you know of any time frame for the progression of that new hospital? Do we know where we're going to be at in the new year? Do we know how work is going to begin on that development?
What first thing is we're well aware, there's ongoing progress in UHL at the moment, as we're well aware. The belief is by the end of by 2029, the next 94-bed unit will be delivered in UHL. There will be other bed units delivered in both Innes, Nina and St. John's. They will be progressing. But the most important thing is now a site has to be identified for option B. That's going to be in progress early in the new year. That's the next thing that's to be done. And from there on then, it will go to procurement, design and continue on in the different stages. And my belief is over the next couple of years, there'll be massive progress with the commitment we got today from the Minister in the briefing we had with her, and to be onwards and upwards going forward.
And Joe, putting your developer hat on for a moment, where would you like to see the project at this time next year? Where feasibly could it be at?
I suppose feasibly, if we were at this design stage, wouldn't we be making fantastic progress? a site identified at design stage, and there have been fantastic progress if we got to that stage. But we all know these take stage by stage. But again, we will be driving it on. The Oireachtas member for the Midwest, from the Midwest region, we'll be driving it on. We'll keep in contact with the HSE and the Minister herself to make sure this is drove on, and her department, because it's vitally important now it progresses. And what the people in the Midwest region deserves, proper health services, and we also will be driving on an improved ambulance service, which is vital and important as well. No matter where these sites are located, our ambulance service is very important, and we're going to drive that on as well going forward.